Welcome to this clinical walkthrough on a Huntington's disease case for UCAMLA, brought to you by Medi8, your 24/7 practice partner. Okay, so for a tricky OSCE station like this, you absolutely need a solid structure. We're going to use the CARE framework. It stands for Clarify, Assess, Reassure, and Educate and Plan. Trust me, it gives you a super clear roadmap for what can be a really tough conversation. All right, let's get into the specifics. Here's your scenario. You've got a 40-year-old man in your office. His mom has just been diagnosed with Huntington's disease. So, naturally, he's terrified he might have it, and, even worse, that he's passed it on to his own kids. This one is all about handling the emotions, so let's break it down. First up, the C in CARE, clarify. Now look, the biggest mistake you can make here is jumping the gun and launching into a lecture on genetics. Don't do it. Your first job is to create a safe space for him to talk. You need to figure out what's really on his mind before you say anything else. So, how do you start? With this exact phrase. After you've confirmed who he is, say this. It's open-ended, it's completely non-judgmental, and it shows him right away that this is his time to talk, and you're there to listen. And these questions here, they aren't optional. This isn't just a checklist. Asking these sets the whole tone. You absolutely have to ask them. They let you find out, what does he actually know? What's his number one fear? Is it about him or is it about his children? And what does he expect from you today? Get this right, and the rest of the consultation flows so much better. Okay, on to the A for assess. Now that you've listened to his main concerns, it's time to gather some key information. And again, this is not about ticking boxes. You're trying to build a full 360-degree picture of his situation. So you need to hit three main areas. First, his family history. This gives you the clinical side of things. Second, you need to screen him for any personal symptoms. We're looking for red flags here. And third, and this is so important, you've got to explore the impact. How is this whole situation affecting him and his family, emotionally and socially? And just a quick note here, the only way to get truly confident with this stuff is by doing it. So remember, you can practice this exact case right now. Get objective feedback on mymediate.com. All right, let's talk about R for reassure. This part is so important. And listen, reassurance is not about giving false hope. It's a delicate balance. You need to mix real human empathy with solid factual information to help calm his anxiety. A phrase like this is perfect. It works because it validates how he's feeling. You're essentially saying, hey, it's okay to feel this way. Anyone would. That builds a huge amount of trust and lets him know you're in his corner. Okay, the big number, 50%. This is the core statistic of the whole consultation. And how you explain this number, well, it changes everything. Notice the wording here. It's so specific. You're not just dropping a scary number on him, you're balancing it. You say there's a 50% chance he has the gene, and then you immediately follow up with the flip side, a 50% chance he didn't inherit it at all. It's about presenting both sides of the coin. That's how you offer real clinical reassurance. And here's another piece of reassurance you can give him. Remember when you asked about his own symptoms? Since he doesn't have any, you can tell him straight up. That's a good sign. It's a simple, true statement that can bring a lot of comfort. And that brings us to the final step, E for educate and plan. Your job here is twofold. Give him clear, simple information, and then give him a concrete plan. This is all about empowering him, giving him back some sense of control over a scary situation. First, you need to define Huntington's, but keep it simple, no jargon, something just like this. Focus on the key areas it affects: brain, movement, cognition, and emotions. That's all he needs to know at this stage. Then, break the symptoms down into these three simple buckets: movement, cognitive, and emotional. Grouping them like this makes the information so much easier to digest. It stops him from feeling totally overwhelmed. Now, when you talk about inheritance, you're going to repeat that 50-50 rule. But then you drop this absolute game changer for him. If he doesn't have the gene, it stops with him. His children cannot get it from him. You have to make sure that point lands. It's the most important piece of good news you can give him. You're going to have a pen and paper in the OSCE station. Use them. A simple drawing showing how the gene is passed on can make all the difference. It's a fantastic way to make an abstract concept concrete, and the examiner will love that you're using visual aids. Okay, when the topic of genetic testing comes up, you need to hit these 4 key points. Tell him a test is available, but right away emphasize that this is a deeply personal choice and there's no right or wrong answer. And then, this is critical, introduce the specialist genetic counseling team. They're the experts who will guide him through all the implications, emotional and practical. To wrap things up, you need to give him a clear, structured plan. The examiner is looking for this. Just lay it out like this, in 4 simple steps: a referral, official resources, mental health support, and a safety net. This shows you're thinking about the whole person, not just the genetics. And this is how you safety net. Use these words. It's specific, it tells him exactly what to look out for, and it empowers him to seek help. You're literally telling him you're not alone in this. This kind of clear instruction is non-negotiable. Finally, you want to end the consultation by empowering him. A statement like this is perfect. It acknowledges how difficult this is, and it frames his visit not as a sign of weakness, but as an act of courage for his family. It's a really strong, empathetic way to finish. And the very last thing you say always is this. It's a final check-in to make sure you've addressed all his concerns. It gives him one last opportunity to ask anything he's still worried about. So there you have it. That's the framework. Now, knowing it is one thing, but mastering it takes practice. So go ahead, you can practice this exact case now on mymediate.com. Work through the steps, nail down your phrasing, and you'll walk into that exam feeling confident.